also you can hear the background music. This seminar is also the last seminar in the Public Health International Training course. In the past 2 months, we have been communicating with our professors and students, and we have completed 4 modules and 16 courses and 4 seminars. And I would like to thank all of you, my heartfelt gratitude to all of you. And I sincerely wish you good luck. And this is a very significant and meaningful course during the special time of COVID-19. And thank you for your company for the past 2 months. And I would like to thank all of our sponsors, our National Health Commission, Long Distance Training Center, and also the Life Oasis, the Beijing Common Charity Foundation, and also the other sponsors, including the Columbia China Center. Thank you for your support. First, I would like to introduce this short video to look back to the past 2 months. The Health China Public Health Management Training course starts today, and this is co-sponsored by the China Health Commission, and this is to echo what the President Xi has mentioned in the meeting, that we should focus on public health and to win the battle of the international battle against COVID-19. We should develop the public health together in China, and we should collect all forces to battle the COVID-19. We have seen different agents being efficacy in COVID-19. And the next stage of China can learn from this COVID-19. And the efficacy and the safety of the treatment for COVID-19 is important. We have done a series of measures against COVID-19. What is the challenge that you are confronting you, what you are doing? The collaborations between nations, and to let us spot new cases more rapidly. And we would like to promote the public health system development in China, and we should form this system of culture and to communicate some of the problems that confront all of us. The public health has been very important in the history. The top of the pyramid is a random controlled trial, and we should focus on the vulnerable population. Comprehensive intervention for chronic disease. Hospital infection control under public health emergency, and to establish a system of reporting. We are all faced with these problems. And this is a guideline regarding the management of air conditioners. This is also a premise of our collaboration. First, we should know, and then we should develop our practice accordingly. With that way, we can confirm the nosocomial infection emergency. We have conducted a series of training courses. What could be, we can include those patients in need. And testing for us is a very important thing for us. The most important thing is to prevent mild disease to developing into serious disease and to decrease mortality evidently. We are discussing how we could do at the beginning, how we can do differently. This will make us to think more deeply about the present and about now, about future. The implementation of the policy is also important. And you can weigh the benefits with the risks. Indeed, the lockdown has met various difficulties. different countries has been developing and researching extensively, and to do clinical trial according to the problems. This is to maintain the antibody titer in our body. This is a cyclic course of development, and we would like to develop treatment against rare disease. We are still trying to promote the localized production of drug, and we would like to hand the right to our patient. We have seen great opportunity during the outbreak, and I do believe that this would benefit more patients. And also you can see the molecular type, which signifies great prognosis. We have obtained some medical data and daily monitoring data to do that. Well, that includes culture, the economy, the social system, etc. And this is only a half of our course.
If we are better able to use our data.
With devices, we also need very good staffs.
Second need for technology is to be understandable.
任何一个人面对这种程度，我们都会感到压力。
他们这次新冠疫情呢，感到了压力。
如果我们不处理，会带来这样的问题。
但是在不发达的地区，我们可以看到收入越高，人群越胖。
对于残疾的一个诠释，
我们也需要提升我们对数据的一个收集。
到底这个医患矛盾啊，它背后的这个系统的
patient-doctor relationship, what's the reason behind it? And from the standpoint of psychology, what's the need of the physician and the patients to help the patient to make the right choice? And it's patient-based way of explaining disease. Even though the problem is the same, it can be demonstrated in a different way. With professionalism of medical professionals. How do we do research and treatment? We're faced with various difficulties in our daily treatment. And this is a huge psychology burden for us. During our decision-making, we would like to decrease our suspicions, and we are still faced with challenges. And helping the disabled and diseased patients are our responsibility. The diabetes program has involved a lot of participants. I would like to train more physicians. I'm more courageous than I thought. On the national level, we have different coordinating systems. And to receive medical treatment. After that, we can run normally the hospital. The clinical medicine should be integrated with public health. And we have various training courses for them. We should integrate the public health modules into the clinical courses. We are using that. We are using different channels of communication. That's our great challenge. We should protect Earth, our home. People are trying to do things but not voice themselves. We shouldn't be using fear too much in our publication. And we have established a framework to disseminate knowledges. We have various strategies. Okay, thank you. I think I'm very moved by this video. It's a little bit long, but it's great to look back to the past 2 months and to see all of these more than 100 guest speakers. They are from the clinical medical field, or they are from the public health, technology, or legal service. And we have some opinion leaders in different industries as well as from the media. So I'm really moved by these their presence in the course. And during the past 2 months, we have 4 modules of courses. We have learned about public health general knowledges, and we studied nosocomial infections. And during that course, we have invited some healthcare workers from frontline, straight from Wuhan, to give us lecture. And later we look into the new drug development and vaccination development and how they are influencing the clinical medicine and public health management. And in the 3rd module, we have discussed the medical humanity and psychology, and also the doctor-physician relationship to better protect the rights of physicians, of healthcare workers. And in the last module, we discussed that under the globalization, what's the responsibility for healthcare workers, and how the new media is influencing the field of public health, and how we should utilize the new media to do better our job. And 2 months can be really short for all these topics and for a deep understanding of these topics. But our willingness is to provide you a framework of public health and how it is integrated with clinical medicine, and to raise some of the great important topics in this field. And during your work, you can have some stresses in these topics. So during the past 20 courses, we are very serious. And in this last course, and I would like to make everything a little bit simpler for you. And so, first of all, I would like to invite President Cao Xirong to give us an opening speech, and then later we will have a roundtable discussion. We have invited several friends to give us their discussion, to give us their thought, and also the mystery guest. Who is the mystery guest? I will present you our team behind the stage. So let's move on, please. Director General Cao Xirong from the China Primary Healthcare Foundation to give us the opening message, opening remarks. I'll play the video from him. Distinguished experts, my colleagues, good evening. I'm very happy to join this closing seminar. And first of all, I would like to thank you, academician Zhong Nanshan, who supports this course. And also, I would like to give my gratitude to every expert and my colleagues in the field, and also students, fellow students for this course. And also, I would like to thank all of our staffs in the backstage. So we all know that on March 19th, we have conducted our opening seminar, including as academician Zhong Nanshan and Li Lanjuan, and very important guests. This is our first course. And on April the 2nd, we have kick-started our courses, this Inside COVID-19 Public Health Management training course. And it has been 2 months, and we have conducted 16 courses with 4 seminars. We have included experts, speakers of healthcare workers, public health experts, and 22 international experts from all over the world. And this course is elaborated in 2 languages. This bilingual course has attracted 1 million of healthcare workers and public health workers worldwide. So, faced with with the COVID-19 outbreak, we have collaboratively achieved a stage of success now. And this course, established for the public health, echoes the requirements of our national guidelines and also that of the WHO. We have managed to summarize the lessons that we learned from COVID-19. And that was shared through this course to frontline workers, to frontline healthcare workers all over the world. And also in the public health field, we have discussed the nosocomial infection control and also vaccination development, technology utilization during the public health emergency. And we have shared the wisdom of our guest speakers. And they are all role models to us students. And this is to bridge the gap between the clinical medicine and public health. We have also made very bold tries, for example, to discuss the psychology and the medical humanity under the COVID-19, as well as the global collaboration. And we have included a lot of factors, social factors other than health itself and how it's impacting the situation of public health. And we have combined theory with practice. We have made abstract theories vividly as examples, which induced a lot of discussions. So our China Primary Care Healthcare Foundation, since its establishment, we focus on the primary healthcare in China, and we have been mobilizing different social sectors to invest in the primary healthcare. And at this time, through this Inside COVID-19 course, is also a great step for us as the Primary Healthcare Foundation, and this is also a starting point for us. We have the Health China 2030 guideline, and this agenda has specified our strategy to improve the public health development in China. And during the past NBCC meeting, we have focused on how to integrate the public health system into the clinical care, and also how to develop more our public health system. And we focus on the prevention, diagnosis, and treatment integration. We also discussed the COVID-19. We have Tennyson from the WHO. He said that the health investment should be very important. Health investment is to invest for the future. This is a very health-centered topic, and this is very important nationally. Our China Primary Healthcare Foundation will focus on people-based, people-focused health and one big health, and to do the transmission from treatment to prevention. And we would like to implement health education, prevention, and we would like to involve all walks of life. And we would like to echo the mobilization of the WHO and to promote the public health communication internationally between countries and to improve the people's welfare. And wish you all healthy and good luck. Thank you. Thank you for your care and the confirmation of the job that we have done, and thank you for your support all the way. So next, we'll enter the roundtable discussion, and our topic today is under the globalization, what's the responsibility for healthcare workers? And today we have with us 4 speakers. They are from the Columbia Medical Center, Epidemiology, Dr. Susan Michael Strasser, and also from Columbia University, Pediatric Osteology, Dr. David Roy, and also from the Shenzhen Children's Hospital, President Ma Xiaopeng, and also the Southern Medical University Professor Ha Wei Chao. Welcome, 4 of you. You are all have you are very senior in your field. And after the introduction, our audience can have an idea about all of you and the role that you have played in this field.
Susan Michael Strasser 教授是一个 is a experienced epidemiologist from the Columbia University. She is a member of the ICAP in Columbia University, the executive director, and is in charge of a global public health program in this organization. She has been a manager in multiple organizations, and her specialty is in nursing. She is a registered pediatric nurse and is also a member of the Sigma Theta Nurses Association. She is also a member of an AIDS Nursing Association and the American Nursing Association. She has a degree on public health management from Cape Town University. Dr. David Roy is our old friend who does not need too much introduction, but I would like to mention that for the past decades, he has been working in international health in places including Africa and the Middle East to provide medical care as well as medical education. Recently, in the past years, Dr. Roy has provided surgery opportunities for many children in China. He received a humanitarian prize in 2009 for the work he has done, and he has been awarded the top doctor prizes for multiple times. Dr. Ma Xiaopeng from Shenzhen Children's Hospital is a pediatrician graduating from Tianjin University. He has worked as a pediatric surgeon in Tianjin Hospital. He started working in Shenzhen Children's Hospital in 1997 and specializes in pediatric cardiology surgery. In the recent years, he has been working in the medical department in the hospital. In 2010, he was appointed vice dean of his hospital. Who assists the dean in taking charge of social work and the electronic health records. He is not only an experienced clinician, but is also an experienced manager. Dr. Howie Chao is from Nanjing and is a member of the Communist Party. He is a researcher as well as a pharmacist. Has been certified by a management certification board in the US. He has worked in Jiangsu People's Hospital and has multiple times visited Singapore, Taiwan, and Hong Kong to study hospital management. In management related to data science and hospital management, he has had multiple research experience. And he has had provincial level grants, 5 different grants at the provincial level, and has over 20 publications. Starting from February 11th in 2020, he was part of the team in the efforts to fight coronavirus in Hubei. In assistance to Huangshi City, he was the leader of this team and led the efforts to fight the coronavirus in the city. So our guests are all experienced managers and clinical workers. Today we're talking about the responsibilities of healthcare workers in the globalization era. So as we are moving out of the COVID-19 era, I want to ask our guests to talk about their experience during the epidemic. What kind of work did they do that was different from the work that they usually do? I want to first invite Dr. Michael Strasser to share her experience.
Yes, great. Thank you. And thank you for inviting me to be here with you on this last session of what sounds like an amazing course. You've been very busy. For myself, the majority of my work is international. I am one of the directors of an institute at Columbia University called ICAP. And we work in almost 30 countries, developing and supporting health systems, primarily originally in the area of HIV/AIDS. And the majority of country programs that we support are in Africa, but we also support a program in Myanmar, Burma, as well as in Kazakhstan, Tajikistan, and Kyrgyzstan. And my area of focus has been implementing large-scale programs, public health programs, and HIV care and treatment programs, as well as training of the health workforce. So over the past few months, my work has changed considerably. We are doing two things very quickly and frantically to try to cope. And those two things are, number one, keeping our services going. As you know, HIV is a chronic disease and adherence to treatment is very important. So trying to keep those services going while at the same time rapidly preparing our health workforce to be able to recognize, detect, and respond to COVID-19. And for me specifically, I have been working very quickly with a small team that I have here in New York of 3 education specialists to develop training materials for COVID-19 for a focus specifically for the frontline health worker. What can they do to set up infection prevention control, to set up triage systems, to set up diagnostic systems, and to be able to provide care, especially in where we work in very low resource settings. We work in countries ranging from South Africa, which is a middle income country, to very fragile states, including South Sudan and Sierra Leone. I'll stop there. Thank you.
Thank you for your introduction, Dr. Michael Strasser. I'll first ask everyone to share, and then afterwards we'll go to our roundtable and discuss if there are any common points in our experiences. Next, I would like to invite Dr. David Roy. I know he has had a different experience, but throughout this time, he has been doing everything that he can to help people that he can.
Good evening. It's a pleasure being here and to contemplate this amazing course and to congratulate those who have been so important in making it happen. I have a unique perspective because I left New York City and Columbia in mid-February before I think certainly before I realized how terrible things were going to be in New York, and flew to China. I came here to work, and my friends and family and colleagues at Columbia thought I was kind of nuts to be heading to China at the time. But as it worked out, and as this epidemic has always been, I think, hard for even those of us on the ground and who are reasonably educated and informed to predict, I moved to Beijing, which was the at the time, I think, the safest big city in the entire world. So I've recently moved my work to Guangzhou. But what this, meant for me, it gave me an opportunity after a long active clinical career as a children's spine surgeon to completely reorient my work to providing educational materials to providers and to the public. It was, a real shift. Listening to Susan, I was thinking, she's had a similar shift as she had to account for this pandemic. And we produced with IHL and Juniper MD and other folks a series of almost 20 webinars on various topics that were designed to try to bring the clinical practitioners and policymakers to grips with the pandemic. That is what has kept me going. And now on this, in China, I'm on the other side. And I'm starting to do my clinical work again, and starting to see the lingering effects of COVID-19 on medical practice, on medical practitioners, and on the attitudes of our consumers. So I'm looking forward to the conversation with my colleagues.
Jen声音没开。
Jen has her microphone on mute. Next, please welcome Dean Ma to share. Hello, I'm very glad to be invited to take part in this communication. This epidemic had a relatively little effect on children. For example, in our children's hospital, from the start of the epidemic, we have not had a single confirmed case of COVID-19, but we have had suspected cases. From the very beginning, we have been doing prevention work according to the requirements of the government. So from the start of the epidemic till today, I was at the hospital every single day. All of our departments have been doing a lot of prevention work. Through this pandemic, I think this gave us a warning for all of the managers in the hospital. Our ideas changed a lot. For example, currently the patients that come in have changed. Previously, many people may know that in children's hospitals, we have a lot of outpatient visits. But during the epidemic, we found that common diseases such as colds are coming to the hospital at fewer numbers. But our diseases that are more difficult or specialized, their numbers have not gone down. So we can see that the people's customs in going to the hospital have changed. People are more aware of personal hygiene, of wearing masks and hand hygiene, especially for children. This may have reached a peak in the terms of protection for children. This may have reduced other infectious diseases. Our health management should shift from our previous treatment-focused medicine towards prevention-focused medicine. So for our children's hospital, for the future, our prevention system will be set up according to the National Health Commission's requirements. We will shift it from treating diseases to preventing diseases. Our responsibility will be more on health, improving health literacy. Thank you, Dean Ma. Let's welcome Dean Ha to share. He was in the front lines. I'm sure your experience during the pandemic was very valuable. I'm glad to attend our roundtable tonight. And I'm very happy to be able to discuss our work with COVID-19. I'm happy to see Dr. Roy again, because previously we have had multiple times a very memorable collaboration. Dr. Roy visited my hospital. I was then at the Jiangsu People's Hospital. We have done a lot of work together. I want to thank Dr. Roy for his support in our current seminar. So as a member of the Jiangsu province's team to support Huangshi City in Wuhan, in Hubei, this whole process lasted around 50 days. I learned a lot from this process. I was mostly in charge of communications, which I had not participated a lot in before. But because of the current need, I became in charge of the communications about the epidemic. So my work helped me to realize during the outbreak of an epidemic how important it is to provide transparent information in terms of combating the epidemic. The pandemic is an internationally large event. Our patients and our clinicians have done so much during the pandemic. So how to actually let people know about the work that these people have done, and to have our entire society be aware of this situation and to care about the situation and to assist us. I think this is very important. This information includes the treatment of patients, the efforts of clinicians, and the attitudes from the government. We need to share this information in a timely manner to everyone. So in our prevention work, our communications work played an important role. In prevention of our epidemic, of this epidemic, this is no doubt a global endeavor. I think we should work together to do this, and I'm sure we will be able to succeed in the end. Thank you. Thank you. Dr. Roy is back with us. Professor Michael Strasser, are you back with us?
Yes, I'm here.
Thank you to our experts for their introduction. We see how Dr. Michael Strasser and Dr. Roy both did a lot of educational work during the epidemic. Dean Ma worked on hospital management, And he has also gave us some thoughts on changes in treatment for children. Dean Ha did a lot of communications work. Talking about the pandemic is only our beginning. I want to say that the pandemic will end. Many experts are saying how the virus may not disappear in the short term, so we must learn to live with it. I want to ask all of you, from your experience during the pandemic, globally, when we're looking on public health topics, the trends of topics in public health, have you seen any changes in these trends? Dean Ma mentioned how trends in treatment for children have changes, but I want to hear from Professor Michael Strasser about what she has seen in the US and in her HIV/AIDS work, especially during the epidemic, and in her medical education work. In your eyes, after this pandemic, what changes do you think there will be in public health, and where do you think we should focus our efforts in?
That's a great question. There are changes that I hope to see. I don't know if they will happen. Here in New York City, as you know from the news, we are still very much in the midst of a crisis, and people have gained new appreciation of the importance of public health, of using data to understand population health, to have a health system that is flexible and nimble and able to respond not only in the good times, but in the bad times. So the hope I have is going forward, there will be greater investment in public health. In the United States, we have increased our investment in high technology care, while at the same time decreasing our investment and our appreciation of public health. And COVID-19 has really taught us how important they both are, and how you cannot have a good healthcare system without a strong public health infrastructure. So what I hope to see in the future is a resurgence of appreciation of public health, but more importantly, to begin to rebuild those basic systems at community level, at city level, at state level, that are able to rapidly detect and respond to COVID-19. Here in the United States, we had warnings. We knew that the outbreak was happening in Wuhan for some time. We also knew that it was happening in Italy. We could see how rapidly it was spreading. Yet our society was very slow to enact measures to thwart the spread of the epidemic. And now we see 100,000 deaths in the United States, just an unimaginable number of lives lost. And these were preventable. And so I hope that politicians, the general public, and decision makers reinvest, relook, rethink about the absolute primacy, the importance of public health. I must say that I am concerned that people will quickly forget and move on, wanting to get back to normal life. And this worries me, that we don't remember this critical historic moment and take this as a time to rebuild a much stronger public primary healthcare system. Thank you.
Thank you. I would like to invite David Roy to respond to what my co-stressor has said, how to reinvest and rebuild the system of public health. And from this perspective, and also today's topic, what's the responsibility of our healthcare workers under this big picture? Please, Dr. Roy, what do you think our healthcare workers' responsibility and role, and what's the changes in it?
I think I would echo the comment that Susan just made, that I worry a lot about short memory. Human beings have an adaptive trait, which is to push aside those horrible, emotional, traumatic moments that when natural disasters or death and destruction, you look at the way human beings survive during wartime or during any other big stressful event. And in our own country right now, we have people talking about how, oh, this isn't so bad, and I listen in wonderment. It's like, oh, it's not so bad that, every single bed in New York City was occupied by people on ventilators. 100,000 people have died across the country. It's terrible. And it doesn't matter that the death rate from the overall, compared to the, looking at the overall infection rate is low, but when it happens all at the same time, it kills people and overwhelms the system. And I know that when I'm talking in a format like this, in a forum like this, that I'm, as we say, preaching to the choir, because everyone's listening understands this, but I still can't help repeating it. I think that this has pointed out that we need to double down on the public health education of medical providers. We did a seminar on that very topic in this course, looking at that relationship. And I think that I congratulate my alma mater, Columbia University, or the Vagelos College of Physicians and Surgeons, and the Mailman School of Public Health for developing a very robust system of developing the education, public health education of medical students. But it needs to be more universal, and that would include all providers in our healthcare system. And I do think that now is a really great time to develop those curricula, to develop mechanisms for delivery. I congratulate our group on doing this kind of under Jan's leadership, this kind of opportunistic thing to say, when she said to me a couple of months ago, oh, we can put on 100 courses and reach tens of thousands of people, and by the way, David, we're starting next week. I said, oh my God, we can never do that. But that's what kind of needs to be done now, because I predict that both the political will and the kind of like memory of people's about of the general public about how bad this has been will go away pretty quickly. I've been asked to give a talk to I have a board meeting next week at 4 a.m. My time in New York City for the Weinberg Cerebral Palsy Center. I'm still on the board there, and they asked me to talk about post-COVID Guangzhou. And I said, oh, that's interesting. And they said, yeah, well, we all feel so hopeless, and it just seems like it's never going to end. So I'm speaking, so I'm doing some, with my iPhone, I'm videoing the crowded subway and stores and the bar that I go to and other places to prove that there is a post-COVID life. And I want to say that it's gone from being, in my tenure here, it's gone from this kind of like paranoid behavior by the public as they are really close to the mass, death from COVID-19 disease, to a kind of like, oh, it's okay. And people are like, jostling each other in the subway. And at least here, of course, everyone wears masks in public. So at least we have that. But the rest has really relaxed. But again, this operates as another living example of how effective China was at limiting disease, and so that the restrictions being lifted here make all kinds of sense. But so my hope is for increased emphasis on public health education for providers to provide us with a better base of support and implementation when the next calamity occurs, and of course it will occur.
Thank you, David. So both David and Susan, or Professor Michael Strasser, they have discussed some of those changes and how do we strengthen our public health system, especially under the COVID-19 outbreak, before we forget it all. And also for the healthcare workers, we should stress the public health education in these people. And also Professor Ma and President Ma and President Ha has mentioned the prevention and publicity all related to the public health. I would like to invite first President Ma. You have mentioned we should do more prevention, and now what your team is doing, your team including the healthcare workers, do you think that their skill set or capability or awareness is enough? Are they in the transition period, and what training should we provide for them? Well, I would like to say something that of my experience. Actually, the COVID-19 outbreak is now in a very stable stage here in China, and we have integrated our measures in our routine daily life. And I have contemplated this. First of all, is a change of habits for Chinese people. In the past time, even if Chinese people, they have small disease, they will visit large hospitals for treatment, and that's especially true for children. We have one-child policy, so if the child has a fever, for example, this is very common actually, and this normally caused by virus infection. And as soon as the children have fever, the parents would send the children to the hospital. That was very common in the past time. So during that time, most of our children's hospital is filled with patients. But now during the COVID-19, the patients and the parents, they're thinking again, and they will protect their children at home, and they will not let them to go out for playing. And in this way, even if the children develops fever, they are afraid of the crossover infection in the hospital. And after home isolation, they have discovered that, okay, actually I can deal with fever for my child at home. So this is a change of habits, and this is a change of awareness actually. So this is a change of treatment-seeking habits. So this is a great time for us to develop a referral system. Actually, last year we have 2.5 million outpatient visits for the last year. And also for us, for the city of Shenzhen, we are a very young city. We have average age of 32-year-old. We have a huge number of children, so we have a lot of outpatient visits. I usually say to my colleagues that if we have an outbreak among children, we will be like really, really busy. And can we build a strong enough prevention system in our hospital to provide them timely treatment and isolation? And we should really contemplate about that. How do we use our force to reinforce our ability in the primary care healthcare system, and to provide training for them, and so that they will be treated in their community settings for small diseases. That's the thing that we are concerning. So now we are connecting with municipal health commission so that we would share our techniques and knowledge to primary healthcare settings to those GPs, and to train those GPs. We teach them how to treat certain common diseases in pediatric patients, to provide them with training so that they could deal with these certain diseases and can do that in a homogeneous way, so that can be compared to our designated specialist hospital. That would be great, so that these children will remain on the community level, and that calls for more efforts and training. I think that would be very effective. Great. I think that's very great. And please, President Ha. Okay. Actually, through the COVID-19 outbreak, we're doing the compilation. It's just as David Roy said, it's easy for us to forget. So in the infectious disease has always been there in our history of humanity. For example, the plague has deprived 20 million people's life and has shaken greatly, deeply the socioeconomic structure of that time, the 14th century Europe. So the COVID-19 now has recalled our knowledge of the infectious hospital. And in the past time, we used to forget about infectious disease. Infectious disease does not seem to be a mainstream influencer nowadays. But actually, we have been hit by two major public health emergencies, which include the SARS, MERS, as well as the COVID-19. So I think the history actually repeats itself for so many times. And we should educate ourselves about the infectious disease and how it could impact our society. I think we should establish a totally new system that adapts the infectious disease control and prevention. And during this combat with COVID-19, the public hospitals has showed the great responsibilities in China, as we can all see in this outbreak. So in the future, I think we need more investment in the public hospital, and especially we should train more healthcare workers. So most public hospitals feel a shortage of human resource, and the healthcare workers, they are shouldering responsibility that they shouldn't have. For example, when every patient enters the hospital now, we require their report of history and to take temperature. These are the things that is not there in the hospital, but now they're doing that, and that requires some more human resource. And so for the hospital, we should employ more people for these additional jobs. This is very important. The other is how we prevent the nosocomial infection. Actually, we all know that this COVID-19 outbreak has posed great requirements for the hospital infection prevention. And during the past decades, we forget a lot about the infectious disease. And we can see that various hospitals in China, they did not do a great job in the prevention system and alert system. So when we were in Hubei province, we see that hospital, they have flaws. When they're receiving the COVID-19 patients, they lacked controls in the system. And at that time, we really helped them how to make the management system and the workflows, as well as we set up new passages for a clean person and polluted area, and also the layouts of the hospital, how to provide service in different sections in the hospital. We all help them to set up again a new system again. And also, as mentioned by President Ma, we should reinforce our referral system. So now in the COVID-19, we're trying to reduce the visit to hospital. We should do reservations and to classify our patients to triage. So I think that's becoming more important here now in China, and the COVID-19 has re-educated our nation about the importance of the things that we mentioned. And I do believe that we will do better. Thank you. Thank you, President Han. Actually, I would like to ask you to talk about the responsibility of the healthcare workers. You are talking about your reflection on the construction of the system and what should we do as a society after COVID-19. But I think this is a very common topic in this healthcare system. No matter as healthcare workers or managers of the hospital, you are thinking about what you can play at your position to reinforce the public health system in your hospital. So I think this is, we have seen surprising similarities among your answers. Because the time is limited, I will have the last question. This is a very quick question.
Could you share with me very shortly for 30 seconds or 1 minute, if you had all of the resources you would need, what is the one thing that you will do? Dr. Michael Strasser, can we start with you?
Wow, that's a great big question. If I had all of them, I would restructure the health system, as one of my colleagues said, to focus on preventive care, primary health care, decentralizing health services in the spirit of Alma Ata, as declared by WHO a number of decades ago, to really look at a functional, highly functional primary healthcare system that is in the community, deeply rooted in the community, helping people to live healthy lives and stop spending money on one focus area, which is tertiary care, but balancing that with extremely strong, proactive primary healthcare systems. That would be my goal.
Thank you. A proactive primary healthcare system. This is similar to what President Ma mentioned. So let's invite President Ma to share his thoughts on what he would do if he had all resources. The one thing I want to do is how to have people not get sick, to do our prevention work and to shift from treatment to prevention. This is what we need to do. Thank you. This was wonderful, and it also it mirrors what Dr. Michael Strasser said. Next, let's welcome President Ha. I think I will improve management and training for clinicians. I think if we want a successful battle against the pandemic, we no doubt need a lot of clinicians. We need to help them to grow stronger and to have enough strength to fight and overcome the disease. So to improve and support our medical staff, thank you for sharing. Next, Dr. David Roy, can you share your thoughts on what would you do if you had all the resources you would need?
My work here in China is basically working toward trying to create and improve primary care, which I think is central to the solution for generalized public health problems. One little, if you will, fly in the ointment in terms of my own thinking about this is how effective China was at preventing the spread of this illness out of Hubei with a, I'm going to say, very rudimentary primary healthcare system and how badly we've done in the US with a relatively robust primary healthcare system. So I would say there's more to it than just the primary healthcare system. We've got to look at the public health side. And we also have to look, unfortunately, we have to look at that interaction between public health and politics. That's a really, really important and critical area. So we're going to use all that money and buy the very smartest and best politicians we can find, and that'll help us. So.
This is a very interesting idea. We have only a very limited time, but your ideas gave us a lot of new insights and also hope. I trust that if we all work together, we will tackle tasks one by one and grow bit by bit. Thank you very much. So let us move on to our next session. We have a mystery guest today. Please welcome our 3 mystery guests to join us. Oh, unfortunately, we don't have background music for this. I see that Zhang Yu is already with us. We have 2 other we'll ask our staff to invite our 2 other guests. I see Niu Tong here as well. While we wait for our last guest, please invite Zhang Yu to give an introduction of herself. Hello, I am a medical student from Suzhou University. My name is Zhang Yu. Hello, I am a medical student from Peking Union Hospital, Peking Union Medical College, and I'm very honored to attend this session. Our last guest is not online yet, but I want to ask our 2 guests to share why they are joining us for this session. We're here because we have attended our previous modules from the beginning to the end. From our lesson, we learned a lot, and we want to use this opportunity to share what we have learned. Thank you very much. Yes, our mystery guests today are the main participants of our session today. They are our beloved students. I'm very honored. I want to invite Zhang Yu and Niu Tong to share their suggestions and comments on this session. We only briefly communicated before, but I wish you can openly share with us about what we did well and what we need to improve on. Thank you. In these 4 modules, I think I have learned a lot. I learned a lot about information that it's difficult for me to acquire during my medical education. During our medical school, we are focusing more on our studies, but we have a less of a focus on the broader medical context. So clinicians, they're not only clinicians, but in our clinical work, there are also psychologists and social workers and other people with other roles. So starting to learning this information in medical school, I think is very practical. This is not only what I feel. I shared this course with many of my classmates who also gave very positive reviews. Previously, we had a little notion about public health, but this special course during the epidemic has prompted us to think about the relationship between public health and other fields of clinical medicine and how to bridge the gap between these two different specialties and how to study and read more on this subject in the further. So I think this will really improve our education in the future. On another note, I think these lessons have helped me to see that we have our current education on public health is very limited, and my personal information about new technology is also limited. So listening to our experts talk about online medicine and telemedicine has really opened my eyes and provided me with new ideas for my future career. For me as well as my classmates, this really opened up a new vista for us. After the pandemic, because I am majoring in radiology, during my studies, I will be more aware of new technology and new ideas. I think this is not only helpful for clinical work, but also for research in the future. So I think this kind of course is extremely necessary for medical students. It has given us a lot of new ideas and given us a lot of new information. Thank you. Thank you, Zhang Yu. I would like to invite Neil Tong to share. The current, this session, as a clinician, like Zhang Yu mentioned, during our medical school, we learned a little bit about epidemiology, but otherwise we have very little opportunity to think about how public health relates to my career. But during this pandemic, this course gave me a chance to reassess public health and to think about what public health has to do with my job. And I have learned about how what clinicians can do in such a public health crisis. Because as a clinician, we are unable to see every single patient or do all of the surgeries. In the future, I think I will be able to have a public health perspective. So this is good for my career development, and it is good for my work in the future. I see President Ha is present as well. We invited him to the expert panel, but he said that he has been with us from the beginning. So I'm very glad to invite him to share as a student. I learned a lot from this course. I wasn't able to attend all of the sessions because of my work, but I did listen to some of them. I think the content is very good. It is very relevant, and it talks about COVID-19 and public health system and medical humanities. I think we should have more people to attend this course and to learn from this course. I think if I have opportunities, I think I will try to attend all of our lessons. As a part of hospital management, we still need to continuously learn. Our two medical students gave us a very good they shared their ideas very well with us. I want to say that what we see in medical school and what we see in actual work is incredibly different. At school, we learn more about theory, but in actual work, we may face situations such as the epidemic that our previous work and previous knowledge, it gives us a very different experience. If you have an opportunity to work in the front lines, I think you'll have new ideas on medicine and humanity that is different from theoretical learning. So I hope that you will have a sound theoretical basis that really reflects the responsibility of clinicians in the future and play a greater role in promoting people's health. Thank you, President Ha. He not only shared his thoughts on the course, but he also gave gave some good suggestions for our medical students. All of the courses that you miss are all online, different from regular live streams. All of our courses are freely available on our website. We have organized our courses, and our website also has our learning goals on our website and our videos. And we also have suggested readings and some very simple test quiz questions. If you're interested and if you were unable to attend courses previously, you are very welcome to go on our website. A simple sign up is all that is needed to access these videos. Is Jing, our last guest, here yet? She is here. Can you hear me? Yes. Hello, I'm sorry. Can you introduce yourself? Hello, everyone. I am from a public health background. The other two colleagues were from clinical medicine background. I am also I am working in the Health Commission of Huairou District in Beijing. So I'm already in the career force. As a frontline healthcare worker, I think that our courses, I only attended several courses, one of which was about bridging the gap between clinical medicine and public health. This gave me a lot of new insight, but I am not sure if we had a lesson on medical law. I am personally working in law enforcement in healthcare right now, so this is something that I am focusing on. So our courses have been talking about health promotion and health education, but I think we also should provide support on medical law and medical regulations. For example, I am in Beijing, and we have recently had an anti-smoking regulation. Similar laws and regulations compared to medical education, these regulations may have a more direct effect. So from this perspective, I think we need a comprehensive legislature to promote society's awareness on public health. This might be a more effective way. Thank you, Jing, for sharing your perspective. Indeed, public health policies is an important topic in public health management. Legislation and regulations are incredibly important in our public health management. So thank you. We still have a little bit of time left. I want to invite our three guests to share if we had another chance to, or if we had a chance to improve our course, how do you think we should improve? In terms of improvement, I agree with what Jane mentioned just now about our medical law. Previously, I have seen courses on where an expert on medicine as well as law gave us a lecture. I think we can talk more about the legal side. I think for me in medical school, this will give me another perspective to see the relationship between public health and clinical medicine. Thank you. I am also thinking back from the very beginning when we are talking about public health. We gave a brief introduction, but we didn't have the chance to give a more deep, in-depth talk on medical law. I learned a lot from this course, but if we want to improve, I think this course helped me understand how the public health system works. But from the clinical perspective, I want to have more opportunities to learn about what specific kind of work we can do and more specific methods of intervention or research in public health. Thank you, Nyoto. Last, I want to invite President Ha to give us some suggestions. Our entire course talked about introduction to public health, infectious disease prevention, medical humanities, new technology and drug development, and protection of rights of healthcare workers. And our last module was new media and globalization and medical education and public education. So these are the topics that we touched upon. What topics do you think we can further talk about? I think you mentioned many topics. I want to talk about one issue that is in the front lines in Hubei. Healthcare is really a humanities. We need to focus more on humanities and on the psychological aspects of our patients. For example, in Hubei, many patients, because they had the disease and they lived in quarantine wards for long periods of time, they were not able to see their family, and they were not able to even see the faces of their doctors and nurses because everyone was wearing protective gear. They were very nervous. They don't know how their illness will turn out. So apart from treating diseases, the clinicians also played an important role in assuring our patients and caring for them. So I think apart from focusing on clinical medicine, we also need to think about the humanities and caring for patients. And I think clinical medicine is really, we're giving them psychological care is stronger than the actual clinical care. I think our course is already incredibly comprehensive. In the future, if we can elaborate on the humanities, I think this will be very beneficial to the development of healthcare in the future. And I also want to thank our staff for providing this opportunity. Thank you for your sharing. It is because of you that we have our motivation to improve. I don't know what we will be doing in the future, but it will definitely be promoting health. So when we have new ideas, we'll be in touch with you. Thank you for sharing. Let's move on to our next session, which is
please. Hey, please, let's show the video of our backstage heroes. I am from the China Patient Assistant Association. I'm Wu Hongyan. I'm very pleased to be here in this Inside COVID-19 and to be part of it. The first round of courses is going to end, and in the in this series, and in our next step, we will help our patients and to enrich the contents, and hopefully we can benefit more physicians as well as patients, and to help you to understand the importance of public health in daily life, and this can help China to develop better. And I do wish all success to this program. Hi, hello, I'm Chen Bowen from Juniper, and in this course, I am responsible for contacting our guest speakers. I would like to express my gratitude to all of you who supported this event. Thank you all. Hi, hello, I am Pan Xiaoyu. Actually, I am from osteology department and still a medical student. I am teaching assistant in this course. I do believe that as long as we continue to learn and to give our attention and to help promote, the gap should be bridged between the clinical medicine and public health, and the clinical health and public in China will go a long way. Hi, hello, I'm Song Zeyu. I am mainly responsible for the broadcast as well as communication. I'm using the new media to broadcast all your beautiful wishes and your attentions in the public health. And also I have the chance to meet with all the experts on COVID-19 to explore more. I'm very grateful that I'm born in this era. Hi, hello. I am Yao Yingyuan Phoebe. I'm very happy to join this Inside COVID-19 and to help strategy, and I'm responsible for the marketing. Hi, I'm Wen Fang from the Juniper. In this course, Inside COVID-19 course, I am mainly responsible for invitation for Chinese experts and to communicate with them with the content of the course. And hopefully we could use this course to help healthcare workers in China and all over the world to understand more. Hi, I'm one of the teaching assistants. I am from the Peking Medical College Hospital, and I have completed my intern in the UNAs. I'm also one of the simultaneous interpreters. Hi, I'm Zhai Xi. I'm very happy to be one of the teaching assistants. I am very enjoying the knowledge sharing, and hopefully this can be a starting point for the development of public health, and hopefully can bring this to your daily work. First of all, I'm from the Ask Health. I would like to wish every success to this Inside COVID-19 course. On behalf of the Ask Health, we have contributed to the course design and some of the communication with the experts from home and abroad, and hopefully this can broaden your horizon internationally for healthcare workers and to move to do the transition from treatment to prevention. Hi, I'm Xu Lingzi. I'm also one of the simultaneous interpreters. I'm also a clinical physician myself. I've learned a lot from this course, and hopefully this could help you to serve your patients and to serve more of the health system. I am Yao Hao. I'm a graduate from Fudan University Clinical Medicine, and I've did my MPH in the Duke University. And I'm very happy that we can have all these talents on this program. And I do hope that after you have done this course, you can join the force of public health and to bridge the gap between clinical medicine and public health. Hi, I'm Wang Siyi. I'm very happy to join this course. In this course, I am mainly responsible for managing the fellow students and also the broadcasting live show platform. I want to assist you to understand more about public health and importance of preventive medicine. Thank you. Thank you. I would like to thank all of you behind the stage. You can see that our team comes from various fields and sectors, and only on this program we get to know each other, and we see that we work a lot online, but we haven't met each other yet, actually. But I'm very proud of all of them, and I would like to say thank you to them. So, in the very end, as initiator and the sponsor for this program, I would like to say something from the bottom of my heart. I have a lot of things to say, but I would like to pick 3 words. First is gratitude, the other is change, the other is health. So first, gratitude. We have said so many times thank yous in this live show. I would like to express gratitude from my heart. Thank you for your trust, for your effort, and for your company. And during this course, I have learned a lot myself. And I've also felt that I can really feel my growth, like inner growth. And I'm very grateful for all of you. The second is change. I think the change is the only thing that is not changed in this world. And with the development of technology and the transition of our lifestyle, the change is taking place more and more rapidly. And this COVID-19 is a great example for that. And we used to do face-to-face meetings, but now we are very used to online meetings. I think the change will going to take place forever. But as long as although we do not like changes, we need to adapt to it. We need to stay positive and be open to all these changes. And also, we should be more adaptable to the changes, and this is very important. Last but not least is the health. Health is very important because we do say a lot about health. Health is the fundamental thing to everything that happens in our life. So in this era of social media and in this era where nobody sleeps, we need to give more attention to our health, not only physically, but mentally. I think a healthy lifestyle is the most important thing to maintain a healthy life. So what's healthy lifestyle? In sufficient sleep, balanced diet, and sufficient exercise. And also you need to stay positive, a good mental status. And also during this course, I think what I felt most is that we can also meditate. I've been doing meditation for more than a year, and in the past months, I've been under great pressure. And I have insisted on this practice, and I have get a lot from meditation. So if I am going to give you some tips, I would like to give you these tips. You can try meditation yourself. Yes, and I guess that's all. And last but not least, I would like to congratulate all of you for completing this course. And I will see you soon in this field. Bye.